Today, we're going to be talking about limp and joint pain in a 5-year-old boy. A 5-year-old male presents to the pediatrician's office with concerns of limping. The parents know of no obvious injuries. He has no history of chronic illnesses, and he's been overall healthy since birth. He has recently hit a growth spurt, and mom is wondering if it could just be maybe some growing pains. She says the following. My son was playing with his brothers this week. They tend to play a little rough. I don't think he was hurt, but he's starting to limp, and I don't know why. Sometimes he walks just fine, but at other times, within the past 4 days, he cries out in pain when he puts pressure on his left leg. I have been putting on an ice pack to see if it will help. At night, I have also given him some Motrin, which seems to help him some. He was sick with cold symptoms 2 weeks ago, a runny nose and cough, but he is now feeling better. It's just his leg seems to really be painful for him. He has had no weight loss and his appetite is still good. On physical exam, his vitals are a temp of 98.7, heart rate of 90, his respiratory rate is 18, blood pressure is 98/60. In terms of his HEENT exam, it's unremarkable. His lungs are also unremarkable, clear, easy work of breathing. His abdomen soft, non-tender, he has no guarding, no distension. Cardiovascular exam is all normal. His skin is warm and well perfused, no rash, no redness or swelling over joints. In terms of his extremities exam, he does have pain with extension of his knee, and he is not walking normally. He has an antalgic gait. When he puts pressure on the left leg, it seems to increase the pain that he feels. He has no swelling, as we noted, and he has normal pedis pulses. Neurologically, he's grossly intact. So based on the history and the presentation that you've gotten so far, you want to start thinking about different things. What kind of things should we be considering in a child presenting with limp and joint pain? Based on your most likely diagnosis thus far, what would your next steps in management be? Because right now you'd want to be figuring out what should you be doing with the information that you've been given, especially if this patient is right in front of you. So our differential diagnosis for joint pain and limb issues in a child that presented with a history like what we have could include some of these. This is, of course, more of a general differential so that you have some things in mind. So you want to think about unknown trauma, growing pains, transient synovitis, osteomyelitis or septic arthritis, child abuse, juvenile idiopathic arthritis, a neoplasia like leukemia, or Lecaf-Perthes disease. In terms of narrowing things down a little bit more, what clues help us to knock things off of that list that we just thought about? One, he had no fever acutely. He doesn't have any obvious febrile illness. His age group can also play a role. He has got no obvious trauma, but he was playing with his siblings, so there's a possibility. Could be maybe he just has a sprain or a bruise. He does have a history of viral illness, so that's something to keep in mind in certain joint disorders. He has intermittent pain. He has no chronic medical disorders. He's had no weight loss, so no constitutional symptoms that we can note of. And he does feel better, it seems, with NSAIDs and rest. Test results thus far, it looks like the doctor has worked up a few things. His white count is okay. They did a CRP and ESR, those are fine. His left knee and hip ultrasound were normal with no effusion, and his left knee and pelvis x-ray was also done, and that was normal. So just to keep something in mind, it's always good if you have some limb pain that you don't just focus on that one specific spot, but it's always good at times to have a above and below look as well, because you might pick up on something that you would have missed otherwise. So diagnosis, assessment, and management. In this case, it's actually transient synovitis, or some people call it toxic synovitis, that induced his knee pain and the limp. So the labs and imaging were all normal, no signs of serious joint disease noticed. He was a febrile, so it's less likely that he would have an osteomyelitis or a bacterial causation of the pain and inflammation. He felt better with the Motrin, so that's also a clue that it was not something so serious. Because of these things, he was sent home with reassurance. Mom was told to go ahead and give him Motrin. You could do that every 6 to 8 hours as needed for pain, and of course, resting. If something was to change, it's always good to give the management tip to return if symptoms worsen or if something seems not to be in the right order of things are not getting better within a few days, that you should return for medical evaluation. Transient synovitis is a self-limiting and benign inflammatory disorder of the joint space, specifically the synovial lining. Now, it's not specifically known what causes it, but in some cases, it's found that someone may have had a viral illness in the past, even some trauma, or some sources even say an allergic response. It's one of the most common reasons for limping in young children. It's most prevalent in boys, and it typically affects those that are between about 4 to 10 years old. Pain is often unilateral, and it can even present with referred pain from the hip to the knee or anterior thigh. In order to decrease the pain that children feel, they may hold their leg in a position that would give them the best relief. So sometimes they will hold the leg in flexion or abduction or in external rotation, just all depending on what spot helps to ease the inflammation and pain that they're feeling. They will limp because they want to put as little pressure on the area as possible. Investigation and treatment. It's very important to always have a thorough physical exam, because that will often give you some of the best clues that you need to proceed further. Look for things like swelling, redness, color change. Is there tenderness to a specific area or joint space? How is the patient walking? Do they have any behavioral changes, especially if they're small or infants, or seem to be very uncomfortable when you manipulate or maneuver their leg or arm? Your test to work up joint pain or limp should include things that can demonstrate inflammatory processes. They're general, but they are helpful because in transient synovitis, the CRP and the SED rate is not usually highly elevated. It can be a little bit up, but not extremely, like, for example, in a septic arthritis. Normally the numbers would be really high. Imaging, of course, is very important because that helps you to determine if there are any effusions or if on X-ray any bony changes that might lead you to more conclusive diagnoses. Of course, more invasively would be an arthrocentesis, which can give you cell counts, white blood cells, to see if there's any bacterial invasion. Finding a final diagnosis, if your test results are normal and they're getting relief from an anti-inflammatory like Motrin, normally that's all they need. You just need to control the discomfort, rest, and normally in about a week to 2 weeks, you'll see marked improvement and they'll feel better. Keys to remember. Age group is always good to keep in mind, as diseases present differently based on the age. You want to also reflect upon whether anti-inflammatories were helpful, because if it is, and you don't have any more suspicious or concerning labs, and most likely it's a benign process that will resolve on its own. Remember your imaging studies, and then also think about any chronic or systemic findings that you are discovering, as it may be something that you need to pay a little bit more detail to, that will help you to find exactly what is going on in the patient presenting with limp and joint pain. Always remember, if you want to take a deeper look, you can always sign up for the corresponding course that goes with the case presentations. Thank you so much.